My brother was just 27 years old when he died from complications of Addison's disease. How many people do you know with Addison's disease? A friend, a family, or a coworker? Addison's disease is rare, and it's an autoimmune disease where your immune system attacks your own adrenal glands. I know about this because of my brother's diagnosis, and I will relate some of the topics to his struggles. The people in my group are aspiring nursing students or perhaps have a friend, family, or coworker that has Addison's disease. In this speech, I will introduce you to or reinforce your knowledge about Addison's disease by informing you of what is known about Addison's, the signs, the symptoms, and the diagnosis and treatment. First, let's begin with what is Addison's. Also known as hypocortisolism, hypoadrenalism, or adrenal insufficiency, according to the Nursing Clinic of North American Endocrine Disorders 1996 edition, defined it as adrenal insufficiency is characterized by the absence of a deficiency of hormones, specifically cortisol and aldosterone. Those two hormones are produced in the body. Cortisol controls the stress response, and aldosterone controls sodium is salt and potassium secretion. Kidneys, located on the backside around your flank, have little pillow shapes that are the adrenal glands located on top. Tuberculosis used to be the main factor that caused Addison's in the past and still causes it in underdeveloped countries of current. In more developed countries, such as the U.S., according to the 1996 edition of Nursing Clinics of North America Endocrine Disorders, triggers could be trauma, infection, surgery, or drugs. Now, any trauma or deficiency can cause Addison's disease or trigger it. My brother's was caused by emotional trauma of the death of a grandparent and deep depression. Although learning the cause is good, it is important to learn the signs of Addison's to prevent many misdiagnoses. Next, we will discuss the signs and symptoms of Addison's present in individuals. There are many types of Addison's. I am going to focus on the common primary hypofunction symptoms. My brother suffered from fatigue, weight loss, nausea, vomiting, anorexia, which is loss of appetite, darkening of skin, which is knuckles, knees, and elbows, and they crave a lot of salt. Why crave salt? Because the sodium is low and the potassium is high, which creates an imbalance in the body. An Addisonian crisis, my brother described as tingling or numbness in the hands and feet, or all over the body if severe. Also an extreme stomach pain and nausea. According to the Handbook of Pathophys in 2001, profound weakness and fatigue, nausea, vomiting, and dehydration, hypotension, high fever by hypothermia occasionally would be causes of Addisonian crisis. Would be symptoms of an Addisonian crisis. Now that we know what Addison's is and the symptoms present, how will we talk about diagnosis? Now we will talk about diagnosis and treatment. Diagnosis will be different from child to adult. Childhoods need a medical history and they will draw blood at the doctor's office. An adult will have many misdiagnoses, but normally with the darkening of skin, that will be an indicator of Addison's disease. There is treatment since there is no cure. You can treat Addison's disease with drugs only. You need HRTs to replace cortisol and hydrocortisone injections to keep the balance. Now, as I wrap up my speech, we as family members, friends, and coworkers have stronger knowledge of Addison's disease and lifelong struggle the individuals face. I have introduced and reinforced the knowledge about Addison's to inform you what is known about it and the diagnosis. I hope this helps if you have family or friends with this rare disease. We can now all recognize symptoms of Addisonian crisis and perhaps save someone's life.